Because there are a large population in China, especially in Shanghai, we have more than 24 million population. We have a limited health resources, such as limited hospitals and not cover every person at one time. So I think if we got the right data and we just show the true distribution of the disease, the deaths, we can make maybe a plan approximately to the the emergent things, to do some preventive things. I think so. It's very important. There are 16 districts in Shanghai, and the Putuo district is on the west of the Shanghai. In our daily work, I was in charge of the vital statistics, including the death data collection and analysis. We just collect the data and check the death certification if there is something wrong with it, and then we just coding it according to the rules of the international classification disease by the WHO. I was very interested in the cause of how to make a decision on the cause of death. I just learned how to make the decision, and there's a lot of tools to help us. For example, I was now using in our daily work then about the decision table that tells what disease causes another one and which is the better underlying cause of death. So I think it is very useful. And in my opinion, the most important challenge now with this is the different understanding about the cause of death between the clinical physicians and our coding doctors. For example, if the person dies of the pneumonia, the clinical physician will fill in the death certificate with the pneumonia. But in our opinion, it's not very special because there are many diseases that can cause the pneumonia, such as cancer and diabetes, such as something like that. So we try to find the real reason that causes pneumonia, but the clinical physicians don't understand why we do that. Now we just try to use the training. We just use the certificate that make us to get different understanding, to train the doctors, clinical physicians, let them know why we do that. So there will be no why, then they will maybe follow our rules. There is a very complex check procedure in Shanghai to keep the data quality. We are do the check procedure every month, and then we'll be do it again per season or half a year. So that keep our data maybe, in my opinion, not too bad. I want to thank you the whole team of service in Melbourne and the whole team that give us the chance to learn more useful tools and give us many guide and help. In my opinion, there's a long way to get our data quality improved all the time. So I think we need to more communication and keep contact with each other. And then I think I will need more experience sharing. It's very useful and a very cherished opportunity. Thank you very much.